In this video, I would like to give you a brief overview of radioiodine treatment in thyrotoxicosis. Radioactive iodine, or I-131, is a drug which is concentrated mainly in the thyroid gland. Its beta emissions causes extensive damage to local tissues, resulting in ablation of thyroid function over a period of 6 to 18 weeks. Radioiodine can be used for the treatment of thyrotoxicosis due to Graves' disease, toxic adenoma, and toxic multinodular goiter. It can be used as a first-line or a second-line treatment option. It is contraindicated in pregnancy, lactation, and also in patients with moderate to severe or sight-threatening thyroid eye disease. I would like to discuss these contraindications further. We know during pregnancy, the fetal thyroid tissue appears by 10 to 12 weeks. So, if the mother was given radioiodine at or after 10 weeks of gestation, fetal thyroid would be destroyed, potentially resulting in cretinism. Radioiodine treatment increases thyrotropin receptor antibody or TRAB levels. TRAB can cross placenta and enter fetal circulation, resulting hyperthyroidism if fetal thyroid tissue is intact. So, the neonate may be normal, hyperthyroid or hypothyroid depending on the gestational age at the time of exposure to radioiodine. Therefore, neonatal thyroid function should be checked and appropriate treatment should be started immediately after delivery. Regarding breastfeeding, radioiodine is concentrated in breast tissues if a woman is lactating. Therefore, it should be avoided during breastfeeding and for 6 to 12 weeks after cessation of breastfeeding to ensure that radioiodine will not be actively concentrated in breast tissues. Moving on to thyroid eye disease, radioiodine compared with antithyroid drugs or surgery is associated with a twofold increase in the development of or worsening of thyroid eye disease. Generally, in patients with mild or no eye disease, before radioiodine therapy, the changes are often mild and transient, but there may be significant changes in patients with more severe thyroid eye disease. Radioiodine may be used with caution in patients with active mild thyroid eye disease and risk factors for deterioration, including smoking, a high baseline serum concentration of T3, or high TRAB levels. These patients should be treated concurrently with oral or IV glucocorticoids to prevent deterioration of eye disease. Also, in smokers without active thyroid eye disease, you may use prophylactic glucocorticoids to prevent the onset of eye disease. But there is no evidence for or against steroid use among these patients. What is the dose of radioiodine needed to treat thyrotoxicosis? In Graves' disease, we use radioiodine dose that result in hypothyroidism. It could be a fixed dose or individualized dose based upon the size of the thyroid gland and 24-hour radioiodine uptake and turnover. If we are using a fixed dose, it's typically 10 to 15 millicuries, depending on the size of the thyroid gland. The dose of radioiodine used to treat toxic adenoma or MNG is a bit higher, typically 15 to 20 millicuries. Compared to Graves' disease, hypothyroidism is less common after radioiodine treatment of toxic adenoma and toxic MNG. This is because there are areas of focal autonomy which takes up radioiodine well, while uptake is limited in adjacent and contralateral thyroid tissue that is suppressed by the hyperthyroid state. Radioiodine tend to destroy only the autonomous areas. How do we administer radioiodine? It is given orally as a solution or a capsule. If the patient is a woman of childbearing age, you need to verify a negative pregnancy test within 48 hours prior to treatment. Generally, pre-treatment with antithyroid drugs for 4 to 6 weeks to achieve euthyroidism is recommended before administering radioiodine. Antithyroid drugs achieves euthyroidism more rapidly than radioiodine treatment which can be important for patients who are not tolerating the symptoms of hyperthyroidism or who have comorbidities that make them more vulnerable to the effects of hyperthyroidism. There may be a transient exacerbation of hyperthyroidism after radioiodine, which is eliminated by pretreatment. Therefore, pretreatment is really beneficial in certain patients, like in elderly patients and those with comorbidities such as coronary artery disease, atrial fibrillation, heart failure, or pulmonary hypertension. Also, in patients with severe thyrotoxicosis, that is reaching for more than 2 times upper limit of normal range, and those who are not tolerating the symptoms of hyperthyroidism, pretreatment is needed. Radioiodine may be administered as initial therapy without pretreatment in young patients without comorbidities if they are receiving adequate therapy with a beta blocker. Antithyroid drugs should be discontinued before radioiodine treatment in order to avoid impairing the efficacy of radioiodine treatment. If the patient is on carbimazole titration regime, carbimazole is stopped 7 days prior to radioiodine treatment and restarted 7 days after radioiodine treatment to allow better control of thyroid function. But if carbimazole dose is small, that is less than 20 mg per day, you do not need to restart carbimazole after radioiodine treatment. If the patient is on block and replace regime with carbimazole, carbimazole is generally stopped 7 days before radioiodine treatment and restarted 7 days after radioiodine treatment and then continued for 4 months. What about dietary precautions? In hyperthyroidism, we know that radioiodine uptake is usually quite high on a normal iodine diet. So, some guidelines recommend normal diet, but some centers recommend low iodine diet 7 days prior to treatment. You need to avoid iodine-containing supplements, including multivitamins, for a week prior to treatment. Patients should be able to adhere to radiation safety precautions after receiving radioiodine treatment for a few weeks. Patients who receive radioiodine have the potential to expose others to radiation via saliva, urine, or radiation emitting from their body. They should be instructed to avoid the following during the restricted period: sharing cups or utensils, sleeping in the same bed with another person, sexual contact, close contact with children and pregnant women. This means your patient may have to stay away from work for a few weeks. If your patient is having urinary incontinence, radioiodine treatment is contraindicated. What about future pregnancy? Pregnancy should be delayed for 6 months after radioiodine treatment to ensure that hyperthyroidism is successfully cured and hypothyroidism is corrected prior to conception. Some experts suggest delaying pregnancy for a year or more because TRAb levels increase after radioiodine and remain elevated for a year, which theoretically would increase the risk of fetal or neonatal hyperthyroidism. However, unintended pregnancies after radioiodine treatment should be allowed to proceed to term. Congenital anomalies do not appear to be more common in women treated with radioiodine. Conception should be delayed for 3 to 4 months in men to allow for adequate turnover of sperm production. How do we monitor a patient after radioiodine? All patients require monitoring for hypothyroidism or persistent hyperthyroidism. Approximately 10 to 20% of patients fail the first radioiodine treatment. If there is persistent hyperthyroidism 6 months following radioiodine treatment, you may administer a second dose of radioiodine. What are the adverse effects? Radioiodine appears to be quite safe. We use a very low dose of radiation. About 1% of patients can develop radiation thyroiditis. It can cause severe thyroid pain that can last 2 to 3 weeks and may be associated with exacerbation of hyperthyroidism. Treatment is usually with NSAIDs and prednisolone may be required in severe cases. Patients can develop rebound hyperthyroidism weeks to months following radioiodine therapy, likely due to a radiation-related increase in TRAb levels. It is usually transient and can be treated with antithyroid drugs. We know radioiodine can worsen eye disease and pretibial myxedema. That's it, and I hope the content of this video will be useful for you. Thank you very much.